into kind of what you, in a perfect world, like where do we need to go, you think?
And so I think it starts with, we have this concept of differential diagnosis in medicine. And that means given history and exam, right, what the person tells us, what happened, and what we're seeing, how do we put those things together and then make a list of all the things it could be, given the information we have, and then find out what it is, right? That's what we do in all of medicine, is we have history, what someone tells us, an exam, what we observe, and we make a list in some kind of order, and we go through and try to figure it out. Because we want to know what's the problem. And we don't stop at, well, you have a fever, it's fever disorder. Okay, we're going to treat that with fever medicine, and we're done. Mm-hmm. Like, it is important to figure out if it's a virus or a bacteria that's causing your fever. Similarly, there are those concepts that could be applied to brain disorders. And, I'll give you an example. I'm a psychiatrist who's sent 46 patients as of yesterday to my colleagues in rheumatology in the past 3 years. And I have been correct every single one of those referrals, which doesn't tell me about the ones I missed. Mm-hmm. And so where we need to go is augmenting differential diagnosis as part of the process for everybody. Because it turns out that's a hard thing to learn how to do. And unrealistically hard for the number of people who need the help. And so even the concept that we have, mental health professionals who are somehow different from health professionals means we have a whole category of people who are not trained in any meaningful way to assess the rest of the problem. And if you only have, half the book, right, your differential will miss half the things. And even in my own case, I was seeing a patient who I haven't seen for a number of years because she went and saw somebody else, but had seen me before, and I missed the diagnosis. She had an underlying autoimmune disorder in addition to the psychiatric presenting problem. And I was wrong the last time because I didn't do enough of an exam, or maybe time elapsed and things changed or something. But when you put together all the pieces of what's happened in someone's life with biological data, you can get to a better understanding of what's wrong and what can help. And in the case of someone who has an autoimmune disorder and it has presenting mood symptoms, well, you want to treat both in ways that are really going to help. In rheumatology, I think is in some ways miles ahead of psychiatry as a medical specialty. In